KaziRa presents How to cure vaginal infections without using medications. Welcome to the final part of this video series, How to cure vaginal infections without using medications. Here we will discussing 6 methods in this series. Please click the blue link in the description below to watch part 1 and 2. Before that, please subscribe our channel and click the bell to turn on notifications to catch our next upload. Method 5. Preventing vaginal infections. Step 1. Take oral probiotics to prevent bacterial vaginosis. You can take probiotics by mouth, either as capsules or in yogurt. These are mainly useful for prevention rather than treatment of bacterial vaginosis. If you are prone to bacterial vaginosis, eat 1 serving of yogurt daily, about 150 grams, with 4 to give billion CFU, colony-forming units. Make sure to choose a yogurt that has this information on the label. You can also take probiotic capsules according to manufacturer's recommendations. Experts don't know exactly how ingested bacterial cultures in yogurt or probiotic supplements can populate the vagina, but there is evidence that they do. Step 2. Wash your genital area gently. Use a very mild soap and warm water to wash your genital area. Dry yourself with a clean towel or allow yourself to air dry. You can also try drying it with a blow dryer set on cool. Avoid scratching or rubbing your genitals. Keep irritation at a minimum by leaving your genitals alone. Don't scratch or rub the area. Step 3. Wear only white, 100% cotton underwear. Cotton allows your genital area to stay cool and dry. The white underwear avoids irritants that may be in different dyes. Avoid nylon, acetate, and any synthetic fibers. Avoid wearing thong underwear because these tend to be irritating. Step 4. Use a mild detergent for your underwear. Use a mild and fragrance-free soap, such as fragrance-free Woolite, for washing your panties. Do not use fabric softeners or dryer sheets. These also contain chemicals that may irritate you. Double rinse your underwear to ensure that all detergent is gone. Detergent residue can cause irritation. Step 5. Practice good habits with toileting. Use white, soft toilet tissue. Remember always to wipe from the front to the back to minimize the risk of infection from bowel bacteria. Step 6. Use tampons during the day. Instead of using sanitary napkins while you have your period, use tampons during the day. Stay away from deodorant tampons because of the risk of toxic shock syndrome. Replace tampons every few hours, depending on your flow. Do not leave tampons in overnight. Use sanitary pads instead. Step 7. Avoid wearing pantyhose. Pantyhose do not allow the genital area to breathe. They also trap heat and moisture, which creates the perfect setting for bacteria, yeast, and other organisms. Instead, wear nylons with a cotton panty insert. Step 8. Avoid irritating products. Avoid feminine hygiene products, which can irritate the vulva. These include deodorant, sanitary pads, all feminine sprays and deodorants, any products containing Vaseline, oils, or greases. Avoid bubble baths, bath oils, talc, or powder, especially powder that contains cornstarch. Cornstarch provides food for microorganisms. Method 6. When should you try this? Step 1. Treat vaginal infections after getting diagnosed. While some vaginal infections can be cured without the use of medications, it's important to consult your OB/GYN or primary physician before beginning any treatment. Effective natural remedies may vary depending on the type of vaginal infection you have and the severity of the infection. Since some symptoms are common among multiple types of vaginal infections, self-diagnosis is both difficult and risky. An official diagnosis from your doctor is the only safe way to identify the type and degree of vaginal infection you have. Tell your doctor if you have a strong preference for natural remedies. Some doctors are willing to work with you to accommodate this preference, and they should be able to guide you on which remedies would be best to try for your specific needs. Note that trichomoniasis is technically an STI. Natural remedies will not be sufficient to cure an infection caused by trichomoniasis. You will need medication to treat it. Step 2. Consider home treatment if you aren't pregnant or nursing. While many natural treatments are safe for women with bacterial vaginosis or yeast infections, you should avoid most home treatments if you are currently pregnant or may become pregnant, or are currently breastfeeding. Some treatments can inadvertently harm your baby. That being said, if you have a vaginal infection during pregnancy, you should still ask your doctor about treatment. Active yeast infections, in particular, can pass to your baby during birth and result in thrush. Step 3. Match the right treatment to the correct cause. Some treatments are only effective against certain causes of vaginal infection. To avoid possible complications, you should only try a natural remedy promoted for use against your type of infection. Do not use a home remedy suggested for treatment against another type of vaginal infection unless instructed to do so by your doctor. As a reminder, douching can be used sparingly if you have bacterial vaginosis. It is not recommended for vaginal infections caused by yeast or trichomoniasis. Similarly, periodontal gel and garlic cloves should only be used for bacterial vaginosis. On the other hand, a yogurt suppository or probiotic suppository might be effective for both yeast and bacterial vaginosis. Boric acid suppositories are only recommended for use against yeast infections. Step 4. Try natural remedies if you can limit or abstain from sexual activity during treatment. Abstaining from sexual activity may not be necessary for all treatments, but you should check with your doctor or do some thorough research to determine if the remedy you've chosen is safe to you and your partner before engaging in sexual activity during treatment. In particular, exercise extreme caution when taking boric acid suppositories. Boric acid is toxic when ingested, making oral sex especially dangerous. Step 5. Use natural remedies while they continue to work. Natural home remedies can cure vaginal infections in some cases, but if your symptoms don't respond to consistent treatment, contact your doctor again. It is possible that your type and degree of infection can only be cured with medication. Vaginal infections, especially those caused by yeast that won't go away or continually return, may suggest a more serious underlying cause, including diabetes, cancer, or certain STIs. While this won't always be the case, it's important to rule out the possibility by asking your doctor to test you. If your symptoms worsen or do not improve after 3 days of treatment, contact your doctor. It's important to completely get rid of your vaginal infection. If left untreated, you may suffer from future complications, including pelvic inflammatory disease, an increased risk of preterm deliveries, and an increased risk of contracting STIs. Even if you think you cured your infection naturally, consider asking your doctor to retest you to make sure. Hope you all enjoyed this video. If you like this video, please subscribe, share and leave a comment for improvement. Thanks for watching.